Hello, everyone, and welcome. Thank you so much for being here today. So, this session is part of Clued Up, a webinar session series from Clue, where we take a closer look at topics around menstrual and reproductive health. So, this is really a space to learn, to reflect, and to ask questions together. So, for those who may not be familiar with Clue, Clue is a menstrual and reproductive health tracking app used by millions of people around the world. At its core, Clue is really about supporting body literacy, which means helping people better understand their cycles, their symptoms, and what's normal for them. And conversations like today's are a really important part of that work. So today's webinar will focus on tackling period stigma. So we'll talk about why period stigma still exists, how it shows up in everyday life, and what it could look like to talk about periods more openly, especially with young people. This is a really important topic, and it affects things like healthcare, education, families, and workplaces, often in ways that we don't always name out loud. And we'll end today's session with a Q&A. So I'm really glad to be joined by two speakers who bring different but very complementary perspectives today. Our first speaker is Ruby Raut. She's the founder and CEO of WUKA, a company that's focused on creating reusable period products and advancing conversations about menstrual equity and sustainability. Ruby is also a longtime advocate for normalizing periods and improving access to menstrual care, and she'll share more about her work shortly. We're also joined by Dr. Charis Chambers, Clue's Chief Medical Officer. Dr. Chambers is a board-certified OBGYN, and she brings both clinical experience and a strong commitment to making reproductive health accessible and stigma-free. Throughout the session today, we'll have a few quick polls, and these are not to test your knowledge, but to get a sense of where everyone is coming from. And there are no right or wrong answers, and you're welcome to participate at whatever level feels comfortable. And we're going to start with today's first poll. Okay, so for our first poll question, have you ever experienced or witnessed stigma related to periods? Just give a minute for everyone to answer. Looks like most people have answered now, so overwhelmingly, yes. So I think that's very important that we do sessions like this today. And with that, I'm going to hand over to our first, I'm just going to share the results, our first speaker. So yeah, mostly yes. I'm going to hand over to our first speaker. Over to you, Ruby.
Thank you. Thanks, Eve. And thank you for everybody joining in from wherever in the world you are. My name is Ruby. I'm the CEO and founder of WUKA. We are a period care brand based here in the UK, doing period underwear, supplement around period pain, everything around catered around periods. And the stigma piece is like very, very close to me. And I will tell you my story of growing up in Nepal and experiencing the period stigma firsthand. And also give you like why does the period stigma still exist? Because it's not gone away, honestly. Even here in the UK when we are living here, I can still see this on a daily basis. So I want to start first with a definition around period stigma and then start sharing you my story. A period stigma is the shame, silence, and misinformation that clings to something totally natural, just like blowing your nose or you've got a cold. Having a period is just like that. It's when people are made to feel embarrassed, dirty, and less capable because they menstruate. So I grew up in Nepal and I was 12 when I had my first period, and my mom gave me a handful of her old sari cut into small pieces and folded it and told me that they are my period product for the rest of my life. Super sustainable, very uncomfortable to use. And at the same time, my mom also told me that I can't stay at my house because I can't be seen by my dad. I can't go to kitchen. I can't cook. I can't even serve myself a glass of water. So I was sent to my aunt's house. And this tradition is called chopari. In far western part of Nepal, people are sent to a cowshed or menstrual hut. But because that was not not the part of where I was growing up. I went to my aunt's house. And I genuinely, because I never saw this, my sister do it, this was for the first time I did it. I went to my aunt's house thinking that actually I'm going to meet my cousin, but the reality was there was this small room, bed on the floor, cup, bowl, plate, very much separated. And often when the food was passed, it was passed on the floor rather than given on hand. Chopadi actually like literally translates to untouchable. So girls are often seen as untouchable. And it was a really like I think traumatic time to go through, especially when you are 12, having your first period and you are away from your parents. Um, Came home and I was like, this is awful thing to happen. And when I heard that more of the girls in the far western part actually go away from the house, I was like, wow. And this is quite illegal in Nepal. Then I think it was only like maybe 7, 8 years ago when I started talking to my mom about like why this happens. Then she told me this story about like my great grandmother when they did not have any period product, when they used to have period, they used to walk around wearing sari. They didn't have underwear, so they used to bleed wherever they used to go. So my great grandparents told my grandmother to actually go and sit somewhere else, and this sitting away became like the part of norm. And this something that because there was no right product of sitting away became like this culture of seemed as dirty. And then over the time, it carried on because it just became a part of a culture and what we did. And this was very much passed on to my generation as well. So, and nobody questioned about it. So stigma actually sometimes starts from not knowing or not questioning about why we are doing what we are doing. So this is exactly how I felt when I was growing up, dirty and impure. It was also very disruptive. I mean, even in now in Nepal, culturally, you are not allowed to go to a temple. You're not allowed to attend funerals or wedding. And it's often seemed as like a women's issue, you know. And over the years, they are like reinforced by religious and cultural taboos. There's also very little understanding, and I genuinely think that we don't question why we do things in a certain way. So, what does this stigma has effect in our life? And 8 years working into the menstrual world field, I realized that every day when I speak to people, often they say is like, I had a severe period pain and often dismissed by my doctor. There is this huge gap of delayed in diagnosis of menstrual disorder. People when there is a stigma around periods, they don't often talk to the people around them. And what happens is like they suffer in silence. Or sometimes we are told that pain is okay to manage, or there is a period pain and it's okay, it happens to everyone. But such a substantial thing that we cannot actually tell from one person to another what pain is manageable for one person and for the another one. So there's often this delayed in diagnosis of menstrual disorder. In fact, if I share you a couple of stats around it, um, 1 in 10, about like 1.5 million women and people who are assigned female at birth actually have got endometriosis. This is quite similar to having like the amount of people who have got diabetes. And it takes around like 10 GP visit before they actually get diagnosed as endometriosis to them. I mean, this is such a delayed process. I myself just last year found out that I've got fibroids. I have severe pain, but I was told always that pain is normal. And just take a couple of painkillers and you get on with your life. Um, and then my doctor told me I've got like 5 centimeter fibroids and they would like to remove it. So until and unless I think you don't question about your health, um, there is so little that can be done. And I very urge people to actually go to a GP and not suffer from any kind of pain and stuff. It also impacts on like self-esteem, identity, and especially for young people. 64% of the girls who do sports actually drop out of sports once they start their period. This is a huge impact on their growing life. It'll take them another 10 years to get back into sports. So not speaking about stigma around periods has a huge impact on people's life as well. So where do we see everyday stigmatization? Um, I often spend quite a lot of my time these days on supermarkets and supermarket aisle, especially on the period care aisle. I just wanted to go and observe the products in there, how they are spoken, how they are laid out. And this was something I started noticing quite a lot. Whenever they are advertising of, this is especially for incontinence, and then the stigma still stays for incontinence as well. Whenever there's a talk about incontinence in men, it's usually described as like active fit. You can see in the screen, like it's all very positive word, whereas in the women, it's always often said as discreet. In fact, the product itself is called always discreet or tenna discreet. It's almost like people are like the companies are almost telling us like this is something we should hide it or not talk about it. And I think these kind of language really matters. Um, People spend roughly 3 seconds in a period product aisle. That itself tells a whole lot of story about like how much embarrassment and shame is there around period. So I think it's time we should really normalize the language that we speak when somebody's on the period. Let's say they're on the period rather than it's time of the month, or making different languages. And I remember Clue a long time ago did the huge survey of like how do we say periods in different parts of the world, and there were only very few of the countries that would say like period periods or menstruation. Most of them have their own cultural nuances, kind of language around it. Like I remember some of them were like the painters are in, etc. kind of thing. When you say that, you're hiding the fact that you're normalizing a period. So all I would say is like if you ever wanted to like destigmatize like how we can destigmatize period, I would say start from there. There is also a big role that the media can play, and I think in last 3 years, we have definitely seen changes on how period products are advertised. We saw this huge commercial of one of the big brand showing period bloods on a pad kind of thing. This was for the first time after a really, really long time of showing blue liquid. And I think there is so much media can do to normalize this conversation and destigmatize period for general people. This was particularly a campaign that we did in 2022, 2023, and we were the first brand to show clots from your period. And when we aired the TV ad, we got nearly 295 complaints. This was like handwritten complaints on the ASA saying that they found the blood quite offensive. I mean, it took us nearly 15 pages of document to write them back and say like why this is a normal thing and why people. But for us, it was an eye-opening because it just shows that the stigma still exists. And what we found out was as well, this was like quite interesting thing. Most of the demographic who were writing to us were like from in their 50s and 60s. So generationally, what they have seen is they have always seen the blue liquid. So obviously it was a bit of a shock to the system. So, but I think this is changing. With every time, whenever we post about something about blood rinsing, the conversation that we get among younger people is changing. And I think that's the direction that we should be going as well when reinforcing destigmatization of period. So why does it matter? Because it gives a better health outcome. The more we speak about how we feel, the pain threshold, the problem that we are going with, the heavy bleeding, this will give an opening conversation with your friends, with your family to go and seek out for help, which means that it will give a better health outcome. Early support and diagnosis. Why do we have to wait 10 GP visits to actually get diagnosed with something that is as common as getting diabetes, right? More confidence in body literacy. Like, can we support young people to stay in sports, whether through education around periods, whether through talking that periods are normal, whether to talking giving them the right period product. All of these matters a lot. Safer, more honest conversation. Everybody turning up today is like an incredible movement towards like how we can make period destigmatizing, like destigmatizing around period. But periods are not a problem to solve, but it's the silence and stigma. I think we can easily, if we remove the stigma and silence around period, I think we can easily get to in terms of like early diagnosis of any kind of health condition around periods. So, where does it start? So, it starts with us. And then I think for everybody who's coming in here, it starts with us having a conversation, like saying, I'm on my period rather than I'm on my time of my month. That matters a lot because that actually starts a conversation within workplace, within home, within dinner table. So, I would urge everybody to actually say, I'm menstruating or I'm on my period and using the right language. Um, and for me, what I've learned over the time is like questioning our parents and grandparents about like, why we did the things that way we did it. Because I think quite a lot of the time, if we are just in silent following the tradition that we were passed on to, that is also quite problematic. So asking like, why am I staying away away from the kitchen? Because trust me, none of the parents have got answer for this because though all of those tradition has been passed from their grandparents and stuff as well. And then you can start unraveling like actually it's absolutely fine to go in and get a glass of water yourself or attend a wedding or attend a funeral, nothing happened. And most importantly, speak up, share your story. Maybe after today's webinar, you would want to go to LinkedIn, go to Instagram, tell about like what you've learned. And just generally talk about period. Next time when you're on your period, tell the world that you're on your period because you will see that camaraderie of like women comes together and people who have periods come together and they will tell you the stories that you have very unheard of. And I think Dr. Charis will tell you a little bit more about like this opening of the conversation about period and what it does to the community. But yes, that's my action is like next time when you have a period, go tell everybody. Thank you for listening to me.
Thank you, Ruby. That was awesome. And thank you for just setting the stage of what period stigma is and how it has affected you personally and how the culture is shifting. As Eve mentioned, I'm Dr. Charis Chambers. On Instagram, I'm known as the Period Doctor. I intentionally chose that name because I wanted people to have to say period, and it is one of my simple joys of life. Destigmatizing periods is a huge deal for me. Obviously, it's related to the work that I do every day as an OBGYN, but I also have a subspecialty called pediatric and adolescent gynecology, where I take care of our youngest menstruators. So people who are just entering the world of having their periods. And it is so important to set the stage for them where periods are normal, where conversations are accurate, and where their concerns and questions are met with compassion. So, one thing I posed to my followers on Instagram was this question: have you ever felt embarrassed, judged, or dismissed because of your period? And I got plenty of responses, but I want to share a few with you today just so that you understand that you are not alone and you can see how stigma is still very much at play in modern times. One person said, I experienced painful cycles for a number of years, bad back pain, cramps that felt like contractions, and awful bleeding. Could only sleep in one position during that time, and when they had to work, they were changing 3 to 4 times during their shift. They kept wondering why that pain was unbearable and why they kept messing up their clothes. They ultimately found out that they had fibroids. This was done after an ultrasound, and then they underwent a myomectomy a short time later. They said it took months for them to feel like themselves again. They had insomnia during recovery, but now they're finally pain-free. And this is one of the ways in which you can be somewhat dismissed or feel embarrassed because you don't know what's going on with your body and you don't know if something's actually wrong. Another person said they visited their gynecologist that their mom referred them to. And when they went to their visit, they clearly said, hey, I'm having a challenge with heavy bleeding and fibroids and pain and spotting. The gynecologist just did a pap smear and an ultrasound and then called 2 weeks later to say, hey, the fibroids are small, so you shouldn't worry about them. But this person was disappointed because they felt dismissed. They were miserable and they needed solutions. But they felt like the gynecologist was more concerned with how young they looked instead of actually helping them find real ways to feel better. And that's just another way in which someone can be dismissed. Another person said they'd be out of school and work for 2 days due to their cramps. They weren't able to move, they were bedbound, and their flow was heavy. They were miserable and they told their mom, but their mom was the same way. So they said, it's okay, it'll just get better. And so this is dismissal that comes in the form of comfort, where parents are like, hey, I've suffered through this same thing. I know this song. We just sing it and this is life. And so it's not just externally where stigma is perpetuated. It's in the medical system, it's in families, it's in a lot of different places. A few other quick examples. One person said they had awful pain in irregular periods forever, and it was passed off as IBS, which is irritable bowel syndrome with no help or diagnosis. They were dealing with it for so long that they went from a happy and healthy person to an unwell and depressed person. And this is what it feels like when you're being dismissed and you don't know what's going on with your body. Another one said I bled for 14 days when they were 13. They were in boarding school, so they were doing the best they could to take care of themselves, but their female peers, their same age peers, started calling them names, saying that she was dirty and reckless and other terrible things. But now when she looks back at it, she says she was just depressed and anxious about handling everything all at once at that age. Another person shared that their grandmother told them when they got their period at 12 that men could smell them now, and that when she was on her cycle and she walked in a room, she would be known and it would be detectable by people. It terrified her for years, and to this day, 30 years later, she's still very hyper vigilant about smell and still asks her husband if he can smell her. And these are the things that we carry with us. Obviously, there's no validity to that, but it was come from somewhere, it's given from somewhere, and her grandmother passed it down, possibly in an effort to protect her, to let her know, hey, if you can, people can smell you, I want my granddaughter to know, right? And of course, she loves her grandmother. She was raised by her grandmother. Um, but it's still something that has harmed her for decades after the fact. And then another person said, I have endometriosis and it took 12 years to be diagnosed because everyone told me that cramps were normal, that pain between periods was just ovulation, and bleeding between periods is just breakthrough bleeding, and bleeding after sex just meant that he went too deep. They were diagnosed at the age of 33, but after 15 years of suffering and 12 years of looking, intentionally seeking help. And this is the impact of period stigma. This is the impact of shame and dismissal. And it doesn't just affect how we feel emotionally, it affects our health. So I want to take this time to talk about the science of menstruation because a lot of the myths and stigma that we still carry today have a lot to do with not having the education necessary to debunk the myths. So, menstruation is part of a very complex, healthy hormonal cycle that prepares the body ultimately for pregnancy each month. Your uterus doesn't care if you are 12, 24, in a relationship, financially stable or not. Its whole job is to create a prepared environment for the possibility of pregnancy. These signals come from the brain and interact with the ovaries, which sends a signal to the uterus. And it is the brain and our hormones and our ovaries that are working together that allow us to have a menstrual cycle. This is super important to know because I've also heard myths where people say, well, your period started early because you were thinking about boys, or you did something to make your period start early. No, this trigger comes from the brain, and we don't even know exactly what brings it on. So it's not something that you can just trigger yourself. It is an involuntary process that begins at the brain and begins in a cyclic fashion where there is signaling from a variety of parts in your body. So, what is a menstrual cycle? When we think about the true menstrual cycle, if you have started having periods, you are always, technically, on your menstrual cycle. Menstruation or bleeding is a portion of that menstrual cycle. The period is the days of bleeding, and so that actually occurs at the beginning of the menstrual cycle, usually lasting 3 to 7 days. When we count our menstrual cycle, that's typically around 28 days in length on average. That first day of bleeding is the first day of your menstrual cycle. So again, the cycle is all the days from the first day of the period to the next day that's just before your next period. That is the fullness of the cycle. And the way we can kind of think about that is it's a circle. Circles don't really have true beginnings and end, they are a continuum. And so you're always on your menstrual cycle, even though you're not always on your period or you're not always bleeding. The classic menstrual cycle looks like this. And obviously, this is linear because we took a circle and basically broke it in half so that we could look at it as a linear view. This first day here is when our period begins, and that period typically lasts somewhere between 5 and 7 days. That's also a part of the follicular phase, or the phase in which your ovary is forming a new follicle to release that new egg. That makes sense because all of that leads up to the midpoint, which occurs around day 14, which is called ovulation. Ovulation is when your ovary releases an egg. When you have had ovulation, you have two possible outcomes after that: pregnancy or a period. Oh, sorry for the balloons. um, and so, after your egg is released and ovulation occurs, you move into the luteal phase. If pregnancy happens, the luteal phase is actually the corpus luteum, which is an area of the ovary that supports early pregnancy. If pregnancy doesn't happen, the luteal phase is characterized by an increase in progesterone, and then that progesterone decreases because pregnancy hasn't occurred, and that leads to the late luteal phase, which is our fun time of PMS and all of the things that we think of that happen right before our period. And that triggers our bleeding and it starts all over. So, when we think about the actual classic menstrual cycle, there's really two major phases: the follicular phase, where the ovary is making and maturing an egg, the time where the egg is released is ovulation, which is more of a midpoint, and then the luteal phase, which is after ovulation, where your body is determining what's going to happen here. Are we going to have pregnancy? Or are we going to have another period? Our period itself, the time of bleeding, is a small portion of that early phase, that follicular phase. And when we're counting our days of our cycle, the first day of bleeding is the first day of the menstrual cycle. So, when should you talk to a healthcare provider? If your menstrual cycle is interfering with your quality of life, it is time to talk to a healthcare provider. It doesn't matter if other people don't think it's a big deal. It doesn't matter if your mom or sister say, hey, I suffer through this as well. If it is negatively affecting your life, it is appropriate to talk to a healthcare provider. I told my patient just yesterday, if it bothers you, it bothers me. Let's talk about it. So it's also important to talk to a healthcare provider if you have cycles outside of 24 to 38 days in length. Again, this is from first day of bleeding to first day of bleeding, that full length of cycles. We would never want you to bleed for 24 to 38 days. But if you get out of that range, that may mean that there could be some abnormalities as it relates to your hormonal signaling. And then if you have more than 7 to 9 days of variance from cycle to cycle, meaning I had a 24-day menstrual cycle and now I've got a 44-day menstrual cycle, that's a big change. And so you would want to talk to a healthcare provider about why that change occurred. It's also important to talk to a healthcare provider if you go without a period for more than 3 months or 90 days. We worry about that because there's a few things that could be at play. It can mean that there's something wrong with the signaling from the brain level, and so you're not actually having your normal hormonal fluctuations. It can also mean that you're not ovulating, and so that lining of the uterus is continuing to thicken in a way that could be dangerous. So if you go longer than 90 days without a period, and you're not on some sort of hormonal therapy like a birth control that is preventing you from having a period, then you should talk with your healthcare provider about it. Other things to talk about are going to be changes such as unusually heavy bleeding or pain. And a lot of these changes are more so a change from your baseline, which is why it's so important to know your body. You can't know your body if you're afraid to even think about your period or if you don't track your period. So, tracking your period, especially in apps like Clue, gives you the information to highlight these patterns and take note of if there's a change. So, changes are important to bring up. especially changes that are related to unusually heavy bleeding or severe pain. So, you might have noticed this throughout your life, but hormones affect more than just bleeding. And this is an important thing to be aware of. Hormones are chemical messengers that go throughout your entire body. Estrogen, for example, affects your mood. It can affect how much fluid you have around. It affects your bones, your brain, your heart. It affects so many things, your gut health. And so it is not something that's just in your mind if you feel like you have other systems in your body that are affected throughout your menstrual cycle. Hormones affect way more than just bleeding. On our periods, we can have back pain, cramps, bloating, even diarrhea because of inflammatory changes. We can have bad hair days. We can have acne. All of those things are hormonally mediated or influenced by hormones. During our ovulation window or our fertile window, we can feel more energetic or have more confidence or even feel a little happier. We can feel more motivated and more sociable during that time. During ovulation, we can have ovulation pain. As we mentioned, ovulation is when your ovary releases an egg. In order for that to happen, your ovary has to form a small cyst, and that cyst has to rupture. And so that rupture or even that distension of the ovary can cause pain. During the luteal phase, we can have restlessness of sleep, oily skin, low sex drive. You can feel more calm, more tired, and you can even have an elevation in your body temperature. Premenstrually, that's in that late luteal window where progesterone, which is here in this pink line, actually starts to decrease. That's when we can have our increased cravings, our PMS, our PMDD. We can have increased constipation. Even menstrual migraines can worsen around that time. We can also have breast tenderness and just emotional sensitivity. All of these things occur because our hormones affect way more than just bleeding. So, a key takeaway is what's normal isn't some one size fits all sort of thing. What's normal is what's normal for you. And so, it's important to pay attention to your patterns and talk with your healthcare provider about what makes you feel good and what negatively affects your life. So there's no single right period. I always say periods have range, right? There might be the one kid who has a period every 21 days. And so that period, or every 24 days, and that period comes more than once a month because our months have more than 24 days. And there might be a person that has a period every 45 days. And for them, their body, that's normal. Some people say, man, that's not fair because you get to skip a month occasionally. And they do, but that's what's normal for them. So you need to know your own pattern, take notice of changes that occur over time, and feel empowered to ask the questions and seek care. We know that sometimes we ask the questions and we seek the care and we still don't get the diagnosis and we still don't get the treatment we deserve, but it doesn't mean that we stop trying. And science supports open conversation. Science supports forums like this, where we talk openly about periods. What we know is when we provide accurate and age appropriate information, there's reduced anxiety around first periods. Teens can feel more prepared and less embarrassed, and it encourages earlier support when it's needed. Teens that feel embarrassed are afraid to talk about their bleeding that's lasting too long. They can be afraid to even bring up the fact that they don't feel like themselves before their bleeding starts. And so when we open it up for conversations, especially as older generations, people who have had periods or people who have the power to influence those with periods, then we can create safe environments where these conversations happen more often and where people get the support they need earlier.
Thank you, Dr. Charis. That it's just so important when we talk about how much variability there really is out there, how important it really is to just know your own body. and understand what is normal for you so you can be able to spot those changes and how important that is, because the earlier you spot those changes, the earlier that you can advocate for to get care. And that's why we at Clue we're always talking about like how tracking can really help you just understand your body and to get your body. And that's really powerful knowledge. Thank you so much. We're going to hear from Dr. Chambers again in a moment, but I have one more poll. Um, before the next section. Just give me one moment to launch it. Okay, so now we have a short poll, 3 questions about your experience with your first period, or maybe someone close to you if you don't have periods yourself. So just give a moment for people to answer. Okay, so the first question we asked, when you first experienced a period, how prepared did you feel? I'm just going to share the results now. So most of you said that you felt somewhat prepared, that you had the basic information, though a lot of you did say that you did not feel prepared at all. So I hope that this next session can help the future generation as well. And on that, if you had to guide someone through their first period, how prepared would you feel? And fantastically, a lot of you said that you'd feel very confident, which is amazing. And the last question we ask, how comfortable do you feel talking openly about periods? And most of you answered somewhat comfortable, depending on the situation. And with that, I will pass over to Dr. Chambers because it fits nicely with the next part that she'll be discussing.
Awesome. And thank you all for answering those questions. It gives us some good insight. As Eva mentioned previously, there is no right answer. So, how parents and caregivers can talk to teens. This is really huge. A lot of us, when we have our first period, the people we go to are the folks in our house, right? The people who are closest to us. And so it's important that parents and caregivers have the right information and are able and willing to talk about periods openly. One of the easiest things that I tell my parents, especially those that come in with patients to see me, you need to start earlier than you think. And the reason I say that is because too late is not a place that you want to be found in when you have to respond reactively. It sets everyone else up for failure, from your child that's going through it to you as a parent to get behind the ball and try to say, I'm so sorry. Let's see what products we can get or how to make this better. It's an opportunity really for embarrassment and discomfort that we should do our very best to avoid. So start earlier than you think. What we know is that kids actually start to recognize themselves and their body differences as young as 2 to 3. And that's because that's when we do our potty training, right? If you're doing toilet training and you're talking about how you wipe, or if you stand, or if you sit, and all of those things, it's normal for these ages to recognize differences in their bodies. And if we start earlier highlighting those differences in the context of health and happiness, we don't have to then feel so embarrassed about talking about things that are then conflated with sexuality or political influences and all of these things. We're just talking to a kid about their body, and that's really how it should be. But when you start talking much later, after someone's already been embarrassed to develop breast tissue and all of those things, it becomes a kind of reactive, corrective work instead of laying the groundwork for confidence at the very beginning. So start earlier than you think. And you know your child, you know this person. So you want to give age appropriate information. You want to make sure that they understand what you're talking about. But they don't have to understand physiology perfectly. They don't have to understand anatomy perfectly. I have a 14-month-old son, and I can point up to the sky and say, that's a plane. But I do not expect him to understand aerospace engineering. I don't expect him to understand physics, but he can understand that there's a plane because that's what he is seeing and that is the world around him. We should be explaining the world around our kids in a way that they can understand, not shying away from it. Second thing, check your baggage. Many of us have had different experiences around puberty and periods that have left different scars and wounds and different, feelings around things. Maybe we think, oh, tampons are awful. Or, I really had a bad experience with doctors, and so maybe I don't trust them. Or all periods are painful. Or, gosh, I really, really felt depressed and irritated on my period. Just because you had these experiences doesn't mean everyone else has them. It doesn't even mean that your child will have them. Your child, your biological child, is only 50% of you, right? There's still some other influence there, and they're a unique person who deserves to have their own unique experience with periods. Do not lay your baggage on them as they are trying to just navigate this already involuntary and complex and confusing part of their life. As a responsible adult, it is your job to talk with someone like a mental health provider, like a therapist, or even a doctor about what you've experienced and deal with that. Your child shouldn't have to walk you through your own baggage. Another thing that's important is validate emotions and experiences. Maybe for you, your period wasn't a big deal. It didn't bother you much and you just went throughout your regular life. But maybe for someone else, it's a huge deal. And there may be some grief related to it. Maybe they started their period earlier than their peers and they feel like this is unfair. Well, it kind of is unfair. And you should be able to hold room for that and validate those emotions and experiences without minimizing it or comparing it to yours as if yours is the gold standard. Periods have range, and emotions and experiences are not things that have to be validated for being true or false. They're real because someone says they're real. And so, as someone who's supporting a person with the period, you should be willing and able to validate their emotions and experiences. And then offer practical skills and preparedness. One of the easiest things someone can do is make a period pack where you have something like Wuka period underwear, or maybe something for pain control, or maybe a change of pants or a change of the school uniform that you know your child wears. Give them practical skills and preparation so that they feel the support. It's not just you saying support. Support is a verb. You have to really do something to show that support. And then find credible sources. You don't have to be the expert in periods. You don't have to be able to explain the phases of the menstrual cycle perfectly in order to support someone, but point them to credible sources. This isn't the random person on TikTok who's had exactly 3 periods. This isn't the person who's created a recent vitamin company that has no credentials whatsoever, but has decided that they are, the person who's going to make every period in the world enjoyable. That doesn't make sense. So make sure that you are being appropriately critical of people and the resources that you are listening to, because there's truth out there as it relates to science and menstruation, and then there's people out there who are just giving their best guesses. And I think you personally deserve better than just best guesses. And then I want you to avoid common mistakes. Those common mistakes are ignoring things and just hoping it goes away, or leading with fear. Leading with fear that says, hey, now that you are having a period, if you look at a boy, you'll get pregnant. And so you better stay in that. I've heard people say these things. I've heard people use lies and misconceptions and untruths to try to control this person that now has a period. But you can't control someone. And by misleading them and telling them untruths, you actually make them more vulnerable to influences of other people. Because what they learn is that they can't trust you. So they need to find someone else to trust. And so my hope and my wish for parents and caregivers is that despite what your period experience was, you can be committed to improving it for your child, for your nieces, for your cousins, for people you come in contact with, but especially for the next generation. We have the power to make real and meaningful change. We have the power to reduce stigma. We have the power to normalize periods. And we have the power to make period experiences so much better for the next generation. So I want you to use that power, and I promise to partner with you. One way that I'm trying to partner with parents and caregivers is by writing this book. It took me quite a while to write this book, but it's called The Period and Puberty Parenting Revolution. This book actually provides meaningful tools around language and ways to feel confident when talking to young people about their periods and their puberty transition. And so if you're interested, you can scan this QR code to pre-order the book. It comes out May 19th, but it's something that I think is a really important tool for parents so that you don't feel alone, so that you don't feel like you have to do all of this by yourself. You don't, and you shouldn't have to. But this next generation deserves menstruation and a period experience that is not shrouded by fear and shame and embarrassment. And I would invite you all to be a part of that.
Thank you so much, Dr. Chambers. And I love that. We do have so much power, and it just can start with small, little everyday actions. And thank you both to both of our speakers. I think it's such an important conversation that just touches so many aspects of our life, and we really owe it to ourselves and the future generation to really face period stigma head on. And I'm very thankful for both of you for being here and for speaking. And I also want to thank everyone who shared their stories with us on Instagram, and also all of you for joining and for taking part in this important conversation. And as a thank you, if anyone here doesn't have Clue Plus already, we would like to offer you 12 months of free Clue Plus. So that's 100% off. There's some instructions how to get that. If you're not familiar with Clue Plus, we have a ton of educational content on the app. So if you want to learn more about some of these topics that we talked about today, and there's also even a more advanced tracking than is included in the free version, so that you can track and whatever life stage you are, really, your first period to your last period, and everything in between. So thank you. And we also have a special offer from Wuka. If you use the code CLUEDUP20, you get 20% off of all period underwear until the 14th of February. Yes, there, Wuka. And thank you so much for that. And we're going to follow with the Q&A. I'm just going to leave this up for a few more minutes in case you want to take note of the instructions there. For the Clue Plus, you can either scan the QR code right there, sign into your Clue account if you already have one, or create one if you don't have one, and then just follow the steps to check out. The code is applied automatically. And if you don't want to use the QR code, you can just, I guess, I don't even know if you can highlight it, but there's you could type out the URL over there. And we will share the recording of this session with everyone after the session. Maybe it might take a few days to get the recording, but we will share it with all of you via email. Okay, so now we'll go start with the Q&A. Okay, so let's see. So we have one question for Dr. Charis. Is it advisable for virgins to do a pap smear? I think it's a great
That's such
question.
a great question. I literally get that all the time. The idea around this question, for people who are not aware, is that cervical cancer, 99% of the cases are caused by HPV. HPV is human papillomavirus, and what we know is that it is sexually transmitted. And so the idea would be, if you have never had sex, why would you have a sexually transmitted virus that would then lead to cervical cancer? Logically, that makes sense. The actual guidelines that we go off of, which is like the ASCCP, is the leaders on this topic, say that we don't actually remove anyone from eligibility for pap smears. The recommendation is to get a pap smear at the age of 21, regardless of sexual status or age of sexual debut. I connect with you. That does make sense. Like, if I've never had any exposure, why would I need to get this? But the recommendation from a health standpoint is that you still get the pap smear at the age of 21. Again, I hear you. Do with that what you will, but that is the guideline.
Thank you so much. And guidelines may be different in other countries.
They
Is that
may
the
be different in
case?
other countries.
Yeah.
Yes.
And another question. Let's see. Any tips for preventing period leakage so that it doesn't stain our clothes without resorting to tampons?
Yeah. So, Ruby, you want to take that?
Yeah, well, this leak problem is something very common that everybody asks for. Whenever we suggest is we always say for you to carry a spare pair of period underwear when we're out and about. We have got this two-pocket changing wet bag where you keep a used one and unused one in each compartment, so it actually separates quite well. I think when you are in the early onset of your first period, second period, third period, you actually don't know how much you're going to bleed. So it's always wise to carry. But also, like after birth, periods might change. Any life stages, like sometimes you might be stressed or those kind of things, your period might change as well. So we always recommend to carry a spare pair. We also have period according to different flows. So if you feel like you've got a heavy flow, there's a heavy flow. If you've got a very heavy flow, we've got super heavy flow as well. So we always suggest people to wear the right product. And unlike tampons, period underwear, you can actually, because it's an external product, you can wear it for a longer period of time. Whereas tampons, we often suggest like 6 to 8 hours or less, sometimes even. But Dr. Chambers, maybe from your side, like, do you get like quite a lot of questions around leaks?
Yeah, so I get a lot of questions about opportunities to use things other than tampons. So there's when we talk about all of the different period products available, obviously we've got our external products and we've got our internal products. External products are going to be similar in that they're going to absorb blood outside of the body. So that's our panty liners, our pads, and our period underwear. Internal products are going to be tampons, which are also absorbent, and then we've got the kind that don't absorb, they just hold. That's our menstrual cups and our menstrual discs. Some people may find that wearing a menstrual cup or a menstrual disc and period underwear is quite the combo. That means you've got your backup, but you've also got something that holds a larger volume of blood than maybe just a tampon alone. And so, yes, there's a lot of great options that don't include using tampons, and finding the best leak protection is unfortunately a little bit of trial and error. And that means that you just have to kind of pay attention to your cycle and adjust according to the flow of your cycle and how that changes. Again, periods change. When I had my baby, my first period afterwards, I was like, what even is this? And I'm the period doctor. And I was sitting here trying to figure out how to not leak. So leaking is a part of life. I think another important thing is to not feel overly embarrassed about leaking. And if you see someone else who has leaked or has soiled their clothing, help them. Help them, do not embarrass them. Help them to get to a place where they can find what they need to protect themselves and to be able to have their period with the dignity we all deserve.
Thank you so much to both of you. Another question that I think either one of you could answer. Do you have any tips for advocating for better conditions at work when people have their periods? Things like working from home, more flexible schedules, and free period products in the bathroom.
That's good.
Yeah, there's already quite a few campaign actually in the UK that's happening. We have got, I think, over 100,000 signature for menstrual leave for people who experience extreme painful period. And I think that's something you can, if wherever in the world you are, you can start petition, advocating in the government, lobby it for it, because we have seen in Spain, there's a menstrual leave now. We have seen in some parts of India, like change happens when we stand up for ourselves. So I would highly suggest that. There's this special thing that I often suggest to many offices is do lunch and learn. And very much like you can organize that one yourself, and then maybe perhaps like you can lunch and learn about like history of menstruation or history of period product, what people use. And often it's like such a nice way of learning and coming together and talking about things that often doesn't get discussed. And then always back of it, you can go like, hey, can we have actually like a box of tampons pads or something for our office? Or like, can we do work with like brands like us? Like we supply to quite a lot of like ambulance services and all this kind of thing, people who work on a long shift, nurses, like with provision of period product into their workplace and stuff. So I think that lunch and learn actually ties into quite a lot of things that you can do at workplace. But we have seen this change in the UK, definitely. To many places that I go, there are like free period products left in the bathroom. So I think we should speak up for this, and then just normalize the conversation.
Totally agree.
Thank you so much. Another question here. How can I decide, maybe this one for Dr. Charis, how can I decide when pain level is normal when my daughter has her first period? I myself only realized how easy periods can be after my undiagnosed endometriosis disappeared following my first pregnancy. So my baggage is that I grew up not in the UK thinking nearly unbearable period pain was normal and I simply self-medicated. Now she worries when her daughter says she's in pain, how will I know what's normal and what to extent?
Yeah, that's such a great point. And pain, and unfortunately, you can't see it. Like there's signs where you might believe someone's in pain, but because pain cannot be seen, it's so important that there's strong communication. So letting your daughter know that pain is possible and that you want to hear about it. is super important. I want to know if you're in pain. And then coming up with a scale. I mean, it's super easy to say like a scale of 1 to 10, or you could say, hey, is this the kind of pain where if I needed to dance, I could? Or is this the type of pain where don't touch me, I need to be still? Or is this the type of pain where I need help right now, I need medicine, right? Those are different scales. Or something is terribly wrong, take me to the hospital. When we get to a point where the pain is negatively affecting our life, as in, I cannot go to school, I cannot go to work, I cannot participate in my typical activities of being on the dance team or playing tennis, that's a problem. And so the first step in the home is typically to use over-the-counter pain medicine. My personal recommendation is to lead with anti-inflammatory medicine because most period pain is inflammatory pain. And so that can be very helpful. But if it doesn't respond, that is when you need to talk with someone about it. I also would say you should talk to a doctor about periods anyway. Like, go before there's a problem. I love when people come to see me and they're like, hey, my child just started and I wanted to get a baseline for how her pain is. Or I wanted her to understand when we need to come back. And so that's an opportunity. You don't have to wait for it to get too bad. But at the very least, let your daughter know that pain is possible and that you want to hear about it, especially if she's not able to do what she typically does on a daily basis. I hope that helps.
Thank you so much. I'm just answering a couple in the chat. So
Okay.
we have another one. Um, is there any way to confirm that we're PMSing without doing medical tests?
Oh, yeah. PMS is a clinical diagnosis. So you don't do many medical tests for PMS. PMS requires documentation of symptoms, and typically those symptoms need to be present around your period for at least 3 periods in a row. And so that can be physical and emotional symptoms. That can be our breast tenderness, period pain, bloating, irritability, sadness, decreased energy or fatigue, all of those things. And so just tracking them, like in our Clue app, if you track them, that's a great way to show that to your doctor. And that's all we need. Unfortunately, because PMS is so common, it isn't often given the true diagnosis that it requires and deserves. PMS is a syndrome and it is a diagnosis, but you don't have to have that diagnosis to get care or to take medicine to treat the symptoms. Most of the time, the treatment is going to be symptom specific, so you may be able to find some over-the-counter medications that speak to those symptoms that make things bearable while you wait for that diagnosis. But there is no clinical test that needs to be done to confirm the diagnosis of PMS. It is your report and your documentation.
Thank you so much.
Mhm.
We have one question from someone asking if Clue has any additional resources for menstruation and hormonal disorders like PCOS and endometriosis. We do. So I want to direct anyone who's looking for more information on hormonal conditions to helloclue.com. We have an encyclopedia on our website that covers there's a section on endometriosis, there's a section on PCOS, and there's tons of free educational content on there. And then also on our app, if you get Clue Plus today with the 12 months for free, there is tons of content on there as well. So, and we have another question for Dr. Charis. If we're going to be celibate or plan to only have one partner, do we still need to get an HPV vaccine?
Yes, you still need to get an HPV vaccine. So, I tell my patients, it's great to be in monogamous partnerships. That is ideal. But there's always variability in access and exposure and things that you just cannot control. You can control an HPV vaccine. The HPV vaccine is one of our greatest developments as it relates to gynecological cancers in decades. It is amazing. And the side effects are so minimal with such huge benefit. It doesn't just protect against cervical cancer, it also protects against HPV that causes like genital warts. And so there's a lot of benefit for just 1 to 2 shots or a shot series, especially if you start early enough. But I would recommend if you are ever going to engage in any type of intimacy of any type with any gender, that you need to get the HPV vaccine. That's obviously my personal bias. It is your personal choice to decide, but I want you to decide with facts and not fear. And so get the facts and read it all out and see, does this make sense? Do these risks, are they appropriate for the benefits? Are these benefits acceptable with these risks? And so that's how I would recommend you decide.
Thank you so much. We have one more question. I think we have maybe time for one or two more questions. Maybe this one for Ruby. How would you recommend dealing with older family members who are male and feel uncomfortable about the subject, about talking about periods?
Such an interesting question. I think when we talk about periods, often people think period is equal to blood, and then showing of blood is the ideal kind of answer. Periods can be explained in a very like menstrual cycle, right? Like we're talking about this 28 days where hormones fluctuate back and forth, and that happens for over 40 years of your life, right? Like so. I think rather than just defining, and that's what we do, is like whenever we talk about period, we just talk about that bleeding phase. So what I would say is like if you're talking to an older person in a family, talk about more about emotions and how you're feeling rather than just about like that phase of bleeding, I would say. Because for somebody who has never experienced period, or also like never seen, perhaps never discussed in the family from their generation as well as they are growing up, it is quite strange. And even when I talk now with men and boys about period, they often get like, I've got no clue, I have no idea about periods kind of way. And they don't have any clue about it, like our job is to educate them like how we feel. And I think talking more about emotions and how you feel around the period, I think that's quite a nice way to start the conversation rather than giving them a shock factor of like, this is how much I'm bleeding and showing your pad, or like just having that open conversation. So I would start with like, take it easy of in terms of like how you explain how you feel, whether it's pain, whether it's emotional, whether it's you're craving, whether it's like you have a bad hair day, and like some of the phases that we get, and they say like actually, like look, my hair texture changes throughout my cycle kind of way, and then bring that conversation in rather than I think dropping the yeah blood bomb everywhere, which we love to do, but I think it's too much for other people.
Thank you so much. Apologies if we didn't get to your question. If you want to reach out to us on Instagram, if you have any further questions, we will try to answer them there if we didn't get a chance to answer yours, because we're a little bit over time. We just wanted to end with one last question poll. We really want to know, after today's session, how confident do you feel talking openly about periods? Hopefully, we've moved the needle a little bit after today's session. I think most people are saying they feel very confident now, which is just fantastic. And thank you so much to our speakers. Thank you to everyone who joined today. We're just going to. There you go. There are Dr. Charis Chambers' handle and Ruby Watts WooCoware if you want to follow them on Instagram. And of course, like I mentioned, you can check out helloclue.com for our encyclopedia of free educational content. And let us know how you enjoyed this session. Someone was asking if there's going to be any more sessions like this, and the answer is yes. The next one will be Dr. Chambers and myself. We will be talking about period pain and what is normal, what's not, what are the conditions behind period pain. So that one is the next one coming up on March 13th. And then the one after that will be on understanding your fertility, and that's coming in April. So look out for a new webinar session every month on our new Clued Up series. So thank you so much for joining, and have an excellent rest of your day, morning, evening, wherever you are located in the world. And thank you very much.
Oh, that's amazing. Thank you. Have a good weekend.
Thank you.
Bye.